Bill Harrison, and that will start at 11 a.m.
I'm going to turn it over to the stage managers, Dan Ashbrook and John Shea. I'm going to take you to your place in just a second. Yes. All right. And Dan, if you could tell people we're going to start Elizabeth Cochran.
To the Four Seasons of Health Expo. We are ready to start our program for this morning and this afternoon. I want to call everybody's attention to the importance of our first speaker. By now, there's probably nobody here that has not heard about the Affordable Care Act and some of the program changes, such as the dual eligibles pilot project, what is now called Cal MediConnect. So our first speaker this morning is going to be talking about some of these policy changes that affect the health care for seniors here in Alameda County. So I want to welcome to the stage our speaker, Elizabeth Edwards, Masters in Public Health.
各位湾区的朋友，如果你是超过65岁，那么你有白卡或者是蓝卡，你需要到这个舞台的地方来听听。那么这个新的保险计划有什么改变？现在有县政府的专员来这里为你解释，所以欢迎你到舞台这个地方来听听他的演说。谢谢。
Do I say just talk directly to him, or do you want to have?
Want me to try to round up some more people?
No. I don't know if it's worth it to use the microphone.
I would use the microphone so it sounds like there's something going on.
Oh, okay. Well, I'm here today to talk about the Affordable Care Act, at least one subsection of the Affordable Care Act, called in California the Coordinated Care Initiative. And I have handouts on it. Oh. Yeah, okay. The Chinese, I don't know if it's English or Chinese. All right, thank you. So a subsection of the Affordable Care Act in California is a project called the Dual Demonstration Project. It will go on in 8 counties, and Alameda County is one of those counties. It essentially is combining Medicare and Medi-Cal, and it affects only people who have both Medicare and Medi-Cal. And the intent is to provide better coordination between the two systems, because the federal system, Medicare, and the state system, Medi-Cal, do not work entirely well together. So starting in January 2014, there are 2 things that will happen. People with Medicare and Medi-Cal will be asked to enroll in a Medi-Cal managed care plan. And in Alameda County, that would be either Anthem Blue Cross or Alameda Alliance for Health. Hi, thank you for coming. Did you all get a handout?
Yeah, I would pass it.
Okay. I didn't know if you wanted to translate anything yet. don't know if you wanted to do any translation yet. Or...
No, ma'am, it's okay.
Okay.
Yeah,
all right. Okay. So let's start with the what's called CalMedi Connect, or it's your first dot here on the front page of your handout, the dual demonstration project. Starting in probably in October, everybody with Medicare and Medi-Cal will get a notice from the state to begin the process of enrolling in one of the health plans in Alameda County that will be part of this project. And like I said, that will be either Alameda Alliance or Anthem Blue Cross. You have a choice of bringing your Medicare part of your health care into the plan, but you have to enroll in a plan for your Medi-Cal benefits. The idea is that the health plan will help you coordinate the care better between the two systems. And it's highly recommended that you at least try, because you'll have always the option to leave with your Medicare benefit if you don't like being in a health plan. Both health plans are working to find out all the providers that are providing care for people who have both Medicare and Medi-Cal in order to contract with people that with the doctors we don't now have. But each of us has a lot of the doctors in Alameda County. The other part of this is this long-term supports and services. The long-term supports and services are strictly paid for by Medi-Cal. And we'll talk a little bit about what those programs are. In order to get any of those services, you will have to be in one of the managed care plans, Anthem Blue Cross or Alameda Alliance. So if we look on the back side, I have a list of what those programs are right now. In-home supportive services, adult day health services, now called community-based health services, and the multi-purpose senior services program. Those will become, you have to, in order to get those services, you will have to be in a Medi-Cal managed care. Did you want to translate? Do we need translation? No? Okay, all right. That's a brief overview of what's happening starting in January, but notices will come out in October. And what our messages for folks are that if anything comes from the state in your mail starting in October, do not throw it away. Be sure you look at it. It will be very important for you to understand what they're sending to you and make some choices. And there'll be phone numbers to call and people to help you. So, yes, question.
Qualify for Medicare, right?
Right.
But Medi-Cal, not everybody is qualified.
That's absolutely right, yes.
You have to be qualified for Medicare and Medi-Cal.
That's correct. For this program, it's directed for people who have both Medicare and Medi-Cal.
What are the requirements to qualify for Medi-Cal?
It's based on mostly income, but also illness and health condition.
All right. The most important thing is after October, all the mail from the state.
Yes.
Take a look at it and go through it.
Don't throw away your mail from the state. Any other questions?
What's
the difference between the two programs?
The difference between Medicare and Medi-Cal?
No.
Qualify for Medi-Cal.
The Alameda Alliance
And Anthem Blue Cross. Okay, we're both Medi-Cal managed care plans.
Oh, okay.
And we have a very similar network. The difference is that Anthem Blue Cross is a commercial plan, a commercial choice in Alameda County, and Alameda Alliance is what's called a local initiative, kind of grown by the county itself.
Oh, the clinic. Oh, the clinic. Okay.
What's that?
The clinic.
Yes, both plans have the clinics, and both plans contract with solo providers as well as many medical groups. We have a very similar network in this county. what their options are. So I'm not an expert on that. It really varies by income and the parents' income. If they're adults. They will, now my understanding is that the exchange, under the Affordable Care Act, the exchange will open in California, and people who don't have insurance will be eligible to purchase insurance. And some people with low incomes will have special subsidies, and that will include young adults as well. Okay.
各位朋友，如果你是超过65岁，那么你已经有白卡或者是蓝卡，从明年开始，你的福利必须要直接跟 Alameda County 的 Alliance， 就是州政府的县政府的一个协调中心来登记，或者是跟另外一个私人的保险公司，就是Blue Cross Anthem， 就是这两个。所以如果你有这一方面的问题的话，欢迎你到这个讲台这个地方来，我们有Alameda County 县政府的专员在这里为你解释，这个是我们头一节的这个节目，所以欢迎你到这个讲台地方来，那你可以直接询问这个讲员，谢谢。
My husband is here. Somebody else is going to join us.
Tony, Thomas, how you doing? Janet, how you doing? Tony.
So you should try to get They went on to the casino with us.
Oh, okay, yeah.
It's nice, it's fun.
Her name is Amy. She's the pivotal person for all of the
Yeah, she is.
Why go to a casino if you're not going to get?
They're not like $50.
You take a 3-hour bus trip to go what? Eat lunch?
And yet another.
Yeah.